Good evening, everyone, and welcome to our program for tonight, Your Prescription for Wellness, New Roles for Pharmacists at FSHP, and I'm Kathy Baldwin, the president for another week. Our mission is to represent members and provide leadership to enable members practicing in hospitals, health systems, and other organized healthcare systems to include promoting pharmacists and pharmacy as essential components of the healthcare team, among many other things. So to do that tonight, I would like to welcome our speakers. We have Madeline Camejo, Vice President of Pharmacy and Chief Pharmacy Officer at Baptist Health in Miami. Welcome, Madeline. We're very glad to have you tonight.
Thank you, Kathy.
Thank you. We have Scott Jelson, Manager of all our pharmacists, Manager of Pharmacy Wellness and Brand Development. Scott, you'd like to say hello to the group?
Yes, thank you all for joining tonight, and we're definitely looking forward to this presentation with you all.
We also have Brandon Welch, a clinical wellness pharmacist, PharmD, and Mauricio, clinical wellness PharmD as well. And with that, Scott, I think I'll go ahead and turn it over to you.
All right, Kathy, thank you so much. And thank you to FSHP for pushing the dialogue on this topic, because to us, we've spent plenty of time in working on our wellness program and really hoping and helping to define what wellness is and where our role lies. And so hopefully after this presentation, we'll have more optimism for the topic, as well as, have some questions, because at the same time we think about a presentation, we think we're going to be guided, or we're going to be told how to do something. And I think what FSHP and what our health system has done as well is say, let's take that risk. The innovative risk is not one to copy and paste. It's one to create. And we hope pharmacists can actually do that. And with these, these initiatives here, I know that pharmacists, when you look at these slides today, there's going to be a lot of things you already have seen before. And I think putting it all together is going to make a lot more sense. So hopefully you get something out of this, and we will be free to you all to discuss through email and through other means of contact, but we'll get started today. So thank you everyone for showing up, and it looks like we have a good audience right now. So I'll get started. So as you all know, there's a request for continuing education. So my team here will help make sure that we get that code for you, and there's some information there. This will be recorded, so just in case there's an opportunity for you all that you need to have these slides for yourself to review after, we'll make sure we get those over. So these are our disclosure slides. I think, Kathy, would you like us to read them all, or do you think it's okay if we move forward through the slides with each one of us?
The latter. Yeah.
The ladder. I like the ladder.
Go quickly. Yeah.
I'm short. I like ladders. All right. So
quickly.
it's for Mauricio, Madeline, Brandon, and also Dr. Swartz, one of our physicians that we hope to have join us tonight. So here are our objectives, and I will not read them for purpose of the ladder. And but we do look forward to going through each one of these. So I'll take a second here for you to read them. All right, and here's our wellness team. So as you got introduced to Madeline, many of you know her, and she had a vision for us at our health system to validate the evidence that's current, and also to really support our system, whether it be from the prevention side or the chronic care management side, and implementing wellness across the system, and work collectively as an integrative team. And so she asked Michael Dukowski, who hopefully is on, Madeline, right? And I to put together a program and bring some rock stars in, and that's where we brought Brandon and Mauricio, and they'll be sharing with us tonight as well. So this is just to give you some concepts of what we've built since, I would say, Madeline, if you want to chime in, but 10 months now, 11 months.
Yes.
Sorry, it's all a blur when this is all you think about. but we hired their clinical pharmacists and what we like to call the chicken before the egg. We also, with Marissa and some of her background and skills and fellowship with ASHP, we brought her in to collaborate with our other team members to create this pharmacy well-being and belonging committee. And we also brought in our student rotation. We created a course in wellness at NSU College of Pharmacy. I know I saw Elizabeth Shepard on the call as well, and so hopefully other colleagues. And I know Hui was going to come on, but they're doing an amazing job there and taking that leap and that initiative here in the state of Florida. And then we now have created our PGY1 and PGY2 residency electives. And so we really are proud of the things that we've put together. But the reason for us tonight is not to toot the horn. It's to really see what the potential is that each health system, pharmacy as a whole, has right in front of them. So, Madeline, when you came across these numbers and we talked about wellness, and when everybody wants to create a program and there's a bunch of budgeting and financial documents and overhead and so on, especially in the health system, everybody says you got to follow the money, you got to follow the trends, you got to follow where the brand is. So I know, Madeline, you had a lot to say about the money here and where wellness is going.
No, I think it's important because if you look at, we're used to just looking at people who have chronic conditions and chronic care and ambulatory services, but there's a huge amount of folks. And if you look at the industry, it's a $7 trillion industry in wellness and fitness and all the things that come with it. And there's, for us, there's a huge opportunity for pharmacy to have revenue streams coming from this sector. And it's something that I think it's important. And many of us, we have a lot of very healthy folks that may not have any chronic conditions, but do want to know, want to be better in as we get older, improve our health and stay healthy and prevent from any further, early disease of not being able to take care of ourselves. So if you look at the wearables, all the things that are coming that are going to tell you, how do you sleep? How well do you sleep? Sleep is a big, important component of wellness. And sometimes as we get older, we sleep less. And so having to understand all the dynamics, I really think the pharmacist is one of the most important people who can put it all together and really help take this part of the sector into a whole different area.
Yeah, and I couldn't say that better, but I also want to add that we have to look at how do we consumerize health and healthcare and what that actually means. And I think when you look at these numbers, what you do know is that people are paying for wellness and wellness is being paid for. It's whether or not we in our profession are going to be on that boat or waving at the dock as the boat leaves. And I think it's really about understanding that people are going to find these services. It's whether they're going to come to us for them or they're going to go elsewhere. And it's whether or not we can recommend certain services and be a liaison to that information and that education, or we're just going to kind of point the finger to aisle 3 or send them to another institute where we might lose that opportunity. And we'll go through that a little bit as well. So getting back to the slides, this is more of a visual just to talk about the norm, right? What we always hear about, the 6 and 10 have a chronic disease state and the 4 and 10 have 2 or more. And we know these numbers continuously vary between 70%, 60%, so on, and how many people take medications. And what we're really not doing a great job as a health system and not this health system, but a healthcare system as a whole is really looking into individual patients and understanding their social determinants, their work-life balance, all of these things. So we're going to dig a little deep in that and where, again, wellness can be implemented, but just we wanted to kind of paint the picture here and show where wellness has an umbrella. Brandon, Marissa?
To keep driving this point home on wellness, this is where we found wellness actually lives, on the prevention side and the chronic care management side. So I want us to start thinking about these patients that have prediabetes or patients that I call prehypertensive whose labs are trending upwards. And I think that these are great opportunities for us to kind of intervene and guide and coach some of these patients on lifestyle interventions or modifications to prevent that patient from getting a diagnosis of diabetes, prevent that patient from getting a diagnosis of hypertension. Also on the chronic care management side, I always like to use metabolic syndrome as a great example, right? A patient may have diabetes in hypertension, how do we coach this patient from preventing or progressing them to getting a diagnosis of metabolic syndrome if they end up getting high cholesterol, or if they end up getting a higher waist circumference. And so it really gives us a great opportunity to help prevent and delay a patient from getting a diagnosis if they don't need one. And then also, I think the key here and the driving point is making sure these wellness tools that we give them in their toolbox, we're actually following up in 4 to 6 weeks or 3 months to see if what we recommended is actually working.
Yeah, and I always say, and I know our team talks about this a lot, but we look at physicians and we know them to be experts at diagnosing, and with the right steps taken can prevent one. And we as pharmacists, we are experts at medications, and we look at ingredients and chemistries and so on. And I think with the right steps taken, we can also help to prevent, synergize, and deprescribe. And so when we start to look at these areas of opportunity and how they overlap, we don't want to just look at well-being as this preventative service only. We want to also look at it chronic care, and how we are addressing it through our health system is up training our pharmacists within these ambulatory care settings and ensuring that they have the knowledge and the training and the additional scope of opportunity to really improve outcomes. And again, we'll go through that a little bit in some time.
So ASHP already has wellness a part of their residency accreditation standards. So weight loss benefits, pharmacogenomics, digital therapeutics. I mean, how can we either extend or continue to elaborate on this definition of the residency accreditation standards that already exist? And so this isn't a foreign language. I think that, by adding these wellness interventions into these clinical practices, I think it's a great opportunity for us to, again, prevent a diagnosis or to better manage someone's patient's care.
Marissa?
Next slide. Okay, so in this presentation, we're going to talk a little bit about wellness coaching and how that can be added to a pharmacist's scope of practice. So when you think about wellness coaching, it really embodies a lot of different things in terms of nutrition guidance, stress management, weight management, hydration, exercise and movement, sleep and recovery. And these are continuous conversations that we have with our patients or our clients that we continue to address with them over our time with them. And we think of wellness coaching, it's not just a appointment and then like a follow-up, and you may or may not touch back with them in a few months. It's a consistent process. It's a cycle that we are continuously checking in on them, seeing how they're doing, having that strong relationship where you're really able to coach them with behavioral modification and building that trust with them so that they feel strong within themselves to make healthy.
Well, when she comes back, what I think the idea here too is understanding the role of a coach and understanding where an individual is in that journey of their own health, their own wellness. And that's part of being a coach. Sorry, Marissa, you cut off there for a second, but I figured I'd take over before we crash. So I think the idea that we're trying to drive home here is that being able to coach a client is not just telling them what to take and hoping they are adherent to it. It's really understanding where they're at. It's really understanding their work, their social determinants, maybe their financial status. Maybe it's understanding where they are in terms of how they sleep. Hey, I'll tell you, as a father of an 8-month-old, nobody asked me, hey, do you get enough sleep? Because they just see this young, healthy man, in his early 30s, or okay, I'm past early, but 36-year-old male, looks healthy, must be eating right, must be doing everything correctly. And we don't ask those questions. And so going through that process of coaching helps us to identify and how we can change some of those behaviors that may be impeding from some of the outcomes that we would see or prevention that we could as well guide. Marissa, sorry, I don't know if you had anything else to add to that. Sorry about that.
Oh no, you hit the nail on the head right there. I'm just talking about really empowering the patient to be able to make these decisions for themselves. And like you said, meeting them where they are and making sure that they can hit like their own strengths and build on the areas that they need building on. Mm-hmm.
Yeah, where the word "how are you or the words "how are you doing" actually mean something. So So I wanted to take us through a potential workflow of how an engagement and an opportunity, and this is where we start to get into some of those details and then ask some questions. So from a clinical role, we think, hey, pharmacists out there, why don't you offer a free 15-minute consultation? And you could obviously say, I'm going to charge for that. I'm going to do whatever I want to do. That's your decision. I'm just giving you a potential opportunity. So 15-minute consultation, you understand where a client is. Maybe they didn't even know that you offered retail pharmacy services. And that alone, just because they were interested in the word wellness as a consumer, brought them into you. And you talked about something they were interested in. Now they brought their pharmaceuticals to you. So this wellness consultation, you review it and make recommendations through this consult. And we'll go through some of those details as well. So don't worry. But post consult, you provide them the report, something pretty, something that they're going to want to read, not something that's a after visit summary from your EHR. I think it's really about how do you consumerize that consult and make it something that they could take with them to their other providers, their specialists, or even to their family members, which again, from a business perspective, could bring you in ROI there, right? If we start to get whole family health now, but if from a understanding is what you're doing is actually working. What you're doing is actually capturing that audience. So again, the other opportunity is to refer to other services. And again, we'll go through a pure example of this, but referring to other services could be, we recommend certain labs or we recommend, hey, you don't have a primary care physician. We recommend a PCP for you. And so wellness as a whole, and we're trying to look at it from different perspectives, wellness can actually bring other services revenue or bring other audiences that have not had that engagement or exposure to your health system as a whole into that system. And it's really what we call the front door. And then you can offer your coaching services and so on, if that's something that's applicable to your institution or to the client or consumer or what we call a patient. So here's where we go a little bit into an opportunity. And I want to just talk to you all joined us, the 107 or 82, 80. Yeah. Is that correct? 82. So first of all, I don't know how many of you, your parents are out there, your brothers, sisters, grandparents, depending on who you are, and I'm going to ask some questions here. We have the opportunity to do a lot of this as pharmacists. And so you have somebody or a service that can offer these individuals to review their current labs, to monitor and educate about medications and how to synergize wellness approaches. And I think Marissa did a pretty good job of describing some of those services and as well as potential deprescribing or synergizing some of those medications. Maybe this hasn't been done for this individual. You find them where they are again. Reviewing medications and over-the-counter products for food and food interaction, food and med interaction, and looking at what their diet is. So down here where diet and nutrition, if we don't know these things, it's really hard to guide. If we don't know how much somebody's getting sleep and we tell them that they need to cut their calories, but they're staying up and they have insomnia all night, it'd be really hard to manage diabetes. And so I think when we're looking at this whole health approach, it's not looking at some anecdotal approach. It's looking at the things that truly matter. We have the data, we have the evidence on reviewing drug-induced nutrient replenishing through diet and nutraceuticals where we see fit. And again, when applicable to a specific individual, looking at the OTCs and reviewing those OTCs with individuals, maybe providing recommendations for specific products, and then looking at family health history. And so that alone seems like our family member. And I think about my grandmother, having somebody and we do this in consultant pharmacy all across the long-term care facilities. We are that liaison to healthcare. And it's crazy to think like that's where I saw pharmacy really being done. So imagine taking this into your community, your health system, and being able to offer this to your clients. But imagine that being done for your own grandmothers, your own moms, your own siblings. What would that cost for you? What would that meaning be for you if somebody was actually reviewing that? And then somebody came in and looked at these other things like weight management, hydration, exercise and movement, sleep, recovery from a surgery or recovery, sleep and recovery, right? And so when we look at these things and we ask ourselves these questions, yeah, I would love that. So how much would you pay for that? And I'm going to ask the audience to put it in the chat. What would you pay for this? What would you pay for your grandmother, your sibling, your parent, to have somebody go through all of that? And if you guys can comment in the chat, that'd be great. And really help us out. What would you pay for this? Just give us a number. If you say 25 cents, I might be hurt.
I like the 500.
I like somebody put typical copay. I would love to only pay that for, unless it's a copay to an emergency room, then I agree with you.
There's a pretty good range of numbers in here.
Yeah.
All right, so we'll keep moving forward. But as you can see, there's a lot of different approaches to this. Maybe, again, it's hard to give you all the details within a 45-minute session, but I agree, copays. I'd love to have insurance cover some of this preventative as well. And we'll talk about that as through this presentation. So I ask you guys this question now as well. How many of you are doing this for your family and friends right now? How many of you go home and say, I, the pharmacist, have this knowledge to review labs, medications, food, drug interactions? How many of you are going home and saying, family, give me a case. I would love to see your labs and I want to look through all these things. Loving this. I'm loving the fact that there's a lot of people saying, yes, I do that because I do that for my family. But I feel like a lot of times we don't want to take our work home with us. So I saw a hand up. Mary? Oh, I guess that was me. A hand for me. I got it. I caught on quickly there. All right. Well, we'll keep moving forward. So I want to talk a little bit about some things that are coming to fruition in the data and the science behind some of these very amazing, famous drugs that are in the market, as the media puts it. So everybody's favorite new drug, semaglutide, right? When we look at the GLPs and we look at some of the data coming out in some of these articles from the Journal of Clinical Endocrinology, they state that the effects, and you guys could read this, but the effects of aerobic training mixed with the therapy will provide the best metabolic outcomes. And so when we look at something like that, and I want you guys to put yourself in the patient's perspective, who's going to talk to you about this? Medical assistant, the nurse, they're going to help you out with aerobic training. Your physician in that 20-25-minute visit, have time to go over aerobic training. Currently, pharmacists. I mean, who talks to you about this? And now you ask the question, are we going to think about how these drugs affect lean body mass and how we need to incorporate things like proteins and sources of proteins to increase that? We need to look at maybe even tweaking our data and documenting process. Are we looking at lean body mass percentage versus fat percentage? So we start thinking about the opportunities and how we can incorporate wellness and synergize those treatments. So we just wanted to show this for perspective. There's a lot of things out there like this. And so I will turn it over to Brandon.
So Dr. Swartzen, who's the sports team physician for Baptist Health, has been a huge champion for pharmacists. And he actually went as far as writing an article on the value that pharmacists add by having them in the clinic. And so initially, we have his quote here: the pharmacist on our team helps with ordering the medicines, monitors the labs that we need to order, and reminds us when it is time for a refill. But when we brought up this approach of adding a wellness pharmacist to the practice, he saw even more value to what a pharmacist can add. And I wanted him to definitely speak on, the feedback that he's gotten as far as having wellness pharmacists in his practice. Dr. Swartzen?
Hi, guys. Can you hear and see me?
Yes, sir.
Okay. Well, thank you for the opportunity. I think you guys have, I've been listening since the beginning, and hearing things from your point of view is definitely very interesting, because many times we feel the exact same way, right? People show up to our doorstep with problems, and we're constantly problem solving, whether it's, pain, illness, disease, and we never really get a chance to do a lot of the wellness. No one walks up to the counter at CVS and says, I want to get well. That's just a foreign concept for most people. And a lot of people, maybe they come for a physical, but a lot of times the physicals are not really wellness visits the way they should be. So when you think about how complicated medicine is, and the amount of drugs that were available 100 years ago versus 50 years ago versus even 15 years ago, I went to medical school over 20 years ago, almost 20 years ago. And you think about what's available now and how am I supposed to keep up with it, along with keeping up with everything that I'm supposed to know from a medicine point of view and keep in touch with diet. And the point is that I can't do everything. I know I don't know everything, and I can't possibly know everything, which means that in order for me to take the best care of a patient, I need a team of highly qualified people that have different specialties. So in sports medicine, the most common person I interact with is a physical therapist. Physical therapy works great. Do I know how to exercise? Yes. Do I know how to tell people how to exercise? Yes. But I tell them very quickly, I don't know what a doctor of physical therapy knows. And the same with what a pharmacist can do. This is not easy. I think your jobs are hard. I think the whole prior authorization and interaction is hard. I think some of these new genetic testings and things that are available are very, very hard. And the physicians are not being trained on how to do this. And so, me personally, I like relying on people who know what they're doing. And if having a pharmacist on my team, or more than one, as is the case now, in different roles, helps make my job easier and improve patient care, then everyone should be doing this. And if you can't find a good physician partner for this, then I would just keep looking, because there's going to be a lot of people, that a lot of physicians that I know, that will be interested in doing this. And when things are transitioning to value-based care, where we can be paid, all of us, for doing all our work to help people keep out of the hospitals and make sure that they stay healthy. And it's not just about how many years they live, but the quality of their life while they live. I think those are all important things, and you guys are a huge piece of the puzzle. So please come out from the counter and come help us do our job.
Well, Brennan, I will say you didn't do a good job introducing him, because he's probably my favorite doctor, because he's the doctor for the Miami Dolphins and the Florida Panthers. And I get to see all of your pictures, and I'm super jealous all the time. So, Doc, we really appreciate you, and really appreciate you championing the wellness initiatives. So thank you for joining us. I know you got a lot going on with training camp and everything else going on at this time. So we really do appreciate you taking the time out of your schedule.
Hey, no problem. I wish you guys the best of luck.
Thank you, Doc. Have a great night. So we wanted to actually bring you a case from a clinic that we happen to have some experience in. Brandon, Marissa?
So now it's time to put this into practice, right? So here's a case. This is a hallmark example of something we see in our clinic. 47-year-old non-Hispanic white woman was referred to the wellness pharmacist from her orthopedic physician, Dr. Swarton, for osteoarthritis. She's an executive, works 10 to 12 hours per day, skips breakfast, runs 6 miles on the weekend, and only gets 4 to 5 hours of sleep daily. So pretty complex patient, right? Medical history, osteoarthritis, obesity, hypertension, insomnia. And as you can see, there are her labs. So I just want us to take a minute, just as a pharmacist, what are some modifiable risk factors that you would consider addressing? Go ahead and put your answers in the chat.
So far, I'm seeing sleep, weight, diet, exercise, blood pressure. No, breakfast. Yep. More common than you think. Stress. Good.
That'll keep us moving as you all are writing in the chat. Marissa?
Yep. So when we think about this, essentially how Brandon or myself would approach this patient, we kind of look at these areas that we briefly went over earlier. So exercise, someone put in their daily exercise. So clearly this patient, as a busy executive, may not have the time, or they may not feel like they have the time to work out. So implementing some kind of like exercise snack, so to speak, getting up and moving out of their chair, maybe after a meeting, or if they have a meeting on the phone, maybe taking it while they're on a walk. Just implementing some movement throughout the day could really help her increase her exercise, her mobility, just to get her heart rate up a little bit. Really just finding a way to integrate that into her lifestyle would be a really great recommendation for this patient. Another thing we could look at is obviously her medication therapy. So as the pharmacist, we are the
You got muted there somehow. Try again. Sorry.
Okay. Can you hear me?
Yeah.
Okay. So as the medication experts, obviously we can address her medications to make sure she is at the correct doses and is optimal in her therapy. And then also looking at her nutrition. She states that she skips breakfast on a daily basis. So maybe asking her some questions around that. Is she not hungry in the morning? Does she not have time for that? Is there a financial thing in there? Just asking her what is her barrier, what are her goals around nutrition, making sure that she is getting enough protein, getting all the nutrients that she needs throughout her day, and asking her what does her other meals look like? Is she also skipping lunch throughout the day, or is she eating? What is her goals in terms of her nutrition? And then also looking at her stress management. As an executive, I know that many executives have a lot of stress on them, a lot of responsibilities, and asking her how she feels throughout the day. Is it weighing on her? Is it affecting her social life? That's a big thing that we do hear about. And so giving her advice on how she can potentially manage her stress, whether that's meditation or doing some breathing exercises. Box breathing is a great way to kind of just take a few moments and kind of reconnect with yourself. It helps you like lower that heart rate down and reduce that stress. And then also talking to her about her sleep. What does her sleep hygiene look like? Me and Brandon talked about this so much to our patients. Like, are you on your phone right before you go to bed? Are you watching TV? Implementing blackout curtains, things like that to really kind of enhance your experience as you are trying to get into that restful state. Brandon, I don't know if you had anything to add there.
One of the things that we do, excuse me, in the sports medicine clinic, specifically for this patient as a good example, she has osteoarthritis. So typically she'll go to physical therapy. We'll also partner up with a dietitian to try to come up with a one-page handout for the patient of an anti-inflammatory diet. So if you think of medication, right, NSAIDs. So picture NSAIDs and raw materials such as plants and fruits, and implementing an anti-inflammatory diet into this patient's lifestyle to delay the progression of this patient's arthritis.
Yeah, and I couldn't agree with you guys more. And the thing that we think about as a society is that there's a pill for that. And so we think if we take an anti-inflammatory and we have this surgery, that all of a sudden this pill is just going to take away that negative inflammation, because we obviously know some is good. So that negative inflammation. And when we look at that, we have to say, you can't just eat whatever you want and expect this pill to work magically. You're fighting yourself now. So it's implementing that anti-inflammatory diet, both prehabilitation and post-habilitation in some of that regard as well. All right. Keep us moving here. Marissa?
So some other areas that we can really look into this, and these are not limited to these specifically, but these are some of the areas that we work in, could be oncology, neurology, women's health. We see, quite a few women's health patients, menopause, preconception. There's a lot of different areas in which you can really integrate wellness. Sports medicine, like we've talked about, weight management. There's a lot of lifestyle modifications that we can really implement in that space. Employee wellness, that's another area that we've really been trying to have an impact on. As you know, throughout the workday, burnout, all those things are very common within the healthcare field. So any way that we can kind of make that impact and help benefit our employees is a great way. Teaching or demo kitchens, that's something that's an exciting way to kind of integrate nutrition with medications and lifestyle modifications. Endocrinology and mental health is another area of opportunity as well.
All right. So just to go a little bit on some of the things that we already know pharmacists have access to is collaborative practice agreements. So how do we use those? And it's really not different from any ambulatory clinic in that regard, but looking at a patient on an individual level. So again, if that patient comes in, and this is a scenario, patient comes in pre-diabetic, how are we going to monitor their labs if their A1C is at 5.7? How are we going to look at preventing that patient from having to go to a diabetes clinic, let's just say, or getting that pre-existing condition, which we know downstream for a patient can increase their premiums when they go to renew. So when you look at some of these things, and we're looking at the whole patient, and again, this is not anecdotal. This is looking at them and saying, okay, we're going to make sure that your A1C is checked in that 3 to 6 month interval with new ADA guidelines. And we're going to ensure that you're also looking at your sleep hygiene, as mentioned before. But with that using that collaborative practice and within that clinic, we're able to then order those labs for that patient. And again, I think when we look at, and I just want to add this to this as well, when we look at this, it's a lot, there's a lot of wellness or a lot of pieces happening across a system. It's just putting them all together. When somebody's doing a wellness initiative or a wellness consult on you, but has no access to Cerner or your EHR that you use, it's just, to me, it's crazy that even the documentation doesn't even go into the system. So what we need to start looking at is where we can make the most impact within that clinical opportunity. Brandon, I know you had talked a little bit about the patient health questionnaires and review of symptoms. You want to just elaborate a little bit on your experience there?
Yeah, so through a collaborative practice agreement that we have set up with Dr. Swartzen, who you guys saw on earlier, we use patient health questionnaires and review of symptoms to kind of guide what labs we may order. So for example, if we have a patient that comes in, fills out a review of symptoms, and let's just say if they have frequent urination, which could be a sign of overactive bladder, and they're over 50, we may consider ordering like a PSA, something to kind of prepare the physician that we may have to refer the patient to if we have to. So through that collaborative practice agreement, looking at PHQ, R and ROS, again, it kind of helps guide what labs we may order in collaboration with the provider.
And as mentioned in the slide, medication modification and discontinuation. So this is not different from what a lot of ambulatory pharmacists and others are doing across the board. It's just putting that piece together to, again, as Dr. Schwartzman mentioned, reduce that burden on that office and that staff, and recommend out services as we mentioned earlier, and as well incorporate that wellness initiative. So we'll keep on moving here. So some of the billing opportunities that we looked at is incident to billing. As many understand, inside of clinics, we can utilize even through a weight management modifier or CPT, utilizing an incident to billing opportunity there, and then elaborating on services that we can provide. So some of the services that we showed you earlier, being able to offer those programs when we see the opportunity that patient needs more than just what the system is offering or the insurance is paying for or could be paying for. There are some preventative codes that insurances are paying for. I'm sure a lot of you can list them in the chats and help others out. And a lot of this too, it could be cost or revenue sharing. There's a pharmacist up at UNC that does a lot of annual wellness visits, and a part of that clinical a salary is paid for by a revenue share within those clinics that she's doing services for. So I bring this up because when you have the knowledge, you then can start saying why not. When people ask why the pharmacist, why not the pharmacist? And I'll tell you why. We could bring you all of these services. And we talked about aerobic training earlier. We cut out another person that has to be in the mix. It's so siloed as it is. And so it's not about taking somebody's role. It's really about taking over an opportunity and then being that liaison to refer out. And so self-pay is an opportunity for your health systems and pharmacists out there. And a lot of these things can be paid for through the system with FSA and HSA cards. So looking at your nutraceuticals and other areas there. So I talked about this, and I'll be very quick here, is just, looking at wellness as a lead generator, whether it's labs that you're, sending your, more labs to your lab because people are coming to you to look at these preventative labs, and obviously not over referring in that regard, but referrals for other services. We talked about that as well. We talked about, more transfer of medication. So look at your employee population at your health systems. How many, or how much of that population are actually utilizing your pharmacy? How do you increase that? And what are they interested in? They're consumers at the end of the day as well. And so I think just thinking because they're colleagues that they know about your services, maybe it's something that you're not offering. And I think wellness, when we looked at the numbers, is going in that in that route. And looking at supplements and being a liaison for supplements, being an expert at what products to use, what is in that prenatal, where is it being sourced? How can you help that individual along that prenatal or postnatal or preconception phase, and really increasing their awareness and education. So we did a little opportunity here to just showcase some of the visuals that a individual from a pregnancy, somebody that wants to be pregnant, preconception stage, thinks about, what are prenatals should I buy? What nutritional workshops exist? Once I have the baby, what birthing and feeding, locations will I go to? Does your health system offer those? Does your health system offer OBGYNs and PCPs? Do they sell wellness products that can help this individual out and understand and reduce some of that stress? Seeing my wife and others around us that, have been pregnant and gone through that process, it's very stressful. And so being able to help be that liaison for that individual could make this whole process easier, but also at the same time build ROI. You look at a patient that comes from preconception all the way to postpartum, you're talking 10 plus months of a potential client buying, nutraceuticals from you or working with you through your wellness coaching and things of the sort. So just wanted to give some opportunity to have a visual there. So Madeline.
So yes, sorry about that. I lost internet for a few seconds. So one of the biggest things is, trying to sell this. If you're part of a healthcare system, how are you going to sell this to your boss to say things that I always am good at is really kind of developing talking points to the C-suite and how we're going to promote the wellness service. But the biggest thing is where I would always start is, how are you going to develop and what is the pharmacist's role going to be? You have to make it very clear what the pharmacist will be able to do, and then what you can or not bill. And so just as an example below, when I presented to the C-suite, he said, these are the things that the pharmacist will do, and we'll be working with the physicians, and the physicians will allow us to do all of these particular duties. And we focus to make sure that the pharmacist then is very well integrated into the clinic and make sure that this is what we'll be doing. And then the next thing you got to do is really, when you're really presenting, is how you're going to bill for the service. You have to make sure you can identify the patients you're going to target, and what quality measures are you going to take the service and actually compare to. What national standards are you going to look at? And we just put a few of the national standards out here so that you can see that. But that's really the important thing. And the mostly that you're also going to have to work with finance to develop an ROI, for this. You're going to bill $150 per session, and then follow-up sessions at $99, whatever it is that however you're going to bill. Then decide how you're going to do the actual ROI and how many patients you'll see for the year, so that you can show what the possibility of this service and what it will generate from a revenue perspective.
And one thing you have there is the patient satisfaction. We know a lot of our health system relies on patient satisfaction in those surveys, and it's really how, I think the satisfaction of being educated alone and improving some of that adherence, being a liaison again to that care, can improve that patient satisfaction. So,
yeah, and I think the biggest piece to this is once you get the go ahead and they're saying, okay, yeah, we want to go ahead and do this service. The most important thing is then how are you going to market the service and really get everyone involved. And so when you're really looking at a healthcare system perspective, go out and talk to the physicians and their practice managers to see who can refer patients to you, work with your pharmacy leaders and create your wellness team, because it just can't be the one pharmacist. You're really going to have to work as a team to be able to have the different areas of pharmacy that you might want to work on. Also in getting your finance, being able to set up your billing cost centers, all of that needs to be put into place. And the reason I say human resources is because human resources, if you're going to really target wellness, if you're going to target your employees, human resources is usually the person who oversees the benefits for the employees. So it's really important to make sure they know that you're doing this service, be able to communicate the employees so that you're also accessed by the employees. Marketing is a big people that it's important how you're going to market that to not just to internal marketing, but how you're going to market to the external resources. And more than anything is the IT, you're going to have certain things that you need to have an EHR, things that you're going to set up. And then the C-suite, you've already done that when you've gotten them involved. But, having your boss, everybody really who's going to be behind you to make sure that this gets off the ground, it's really important to think it all the way through. It's not just about putting something together and hope and pray people will come. It's really having a good plan so that people understand your service, they know what you want, going out into the community, doing health fairs, promoting. Marketing is a really big part of that to help you improve that service. And if you're not part of a healthcare system, and if you're just out there trying to market for yourself, you have to do the same steps in order to know what it is that you want to get out of your services.
Yeah, and you said IT there, and I think we learned so much about working with vendors and what security levels, of interaction with an EHR and how far in it. I felt at one point I was hearing foreign languages be spoken in meetings, and I was like, why am I even here? I don't even know what they're saying. It got so technical. So, engaging your IT department early and in your finance department early and your marketing department early is important. But at the same time, when you approach it so early, you might confuse people because you're trying to find your lane in some regard. So with that, I have to say, we pharmacists have a duty to be advocates for our profession. And it's so important that we are involved, you guys showing up here tonight, but at the same time, FSHP, even FPA, being involved in our organizations is so important. And I always have the saying that, it's easier to sit at the table than throw rocks at the window. And we have to sit at the table. We have to have these conversations. We have to show our value. And so maybe adding a service line to your current role in your ambulatory setting or your clinical, your clinics, maybe there's just adding some wellness will open eyes to, hey, I went to this lifestyle. I saw somebody put this, the American College of Lifestyle Medicine, went to this as a physician, and you're speaking the same language. I love this. Why don't we create a teaching kitchen together for some of our patients in the community and really help to educate some of the areas that may not have the same level of education. And I wanted to also announce that at FSHP this year, I will be proposing a resolution. So hopefully there's some individual delegates on these calls that could sponsor, or not sponsor, but support, excuse me. But I'm trying to add wellness to the practice of the profession of pharmacy and really have it in the black and white. And I have a saying that I know I have a lot of sayings tonight, but it has to be in black and white before it can be green. And so we really, we saw this with MTMs and other services. We have to start walking the walk. And so I'm trying to do that through our state legislation and through these clinical roles with leadership like Madeline and Mike and champions like Dr. Swartz. I am proposing a recommendation for a definition for wellness in pharmacy, but I will say this, please don't take this as a quote. What I'll say is I'm asking everybody, and when you get these slides or take a picture, hey, help me write one. Let's define what wellness in pharmacy actually means. I know a lot of people say we do it, we do this, pharmacists already do that stuff. They do vaccines. You're right, they absolutely do. But let's define it. Let's stop letting others guide our profession. And so we have added some of our resources, and we want to say a huge thank you. I know how hard it is for me, at least personally, with, again, my 8-month-old to come to an event at 6 o'clock on. So I'll just say thank you all for joining, and hopefully you got something out of this. But if there are any questions, we'd like to hear them. So the floor is yours. If you want to raise your hand, we can call on you.
Thank you. It's Kathy again.
Yeah.
I popped back on here. I put a note in the chat for everyone to please come join us next Friday, Saturday, and Sunday at Gaylord Palms in Orlando for our annual meeting. And thank you for showing this request for continuing education Please note the link will be active until August the 4th. So you will have until that time to complete your CE.
And don't forget to follow the LinkedIn of FSHP while you're here. I added a QR code for all of you. So just take your phones out and follow them, engage, at least know what's going on. Maybe you could see some gaps and we can help fill them together. So let's be part of something progressive as a profession, and let's not talk about it, let's walk about it. So does anybody have any questions? I know there's some in the chat here. Lots of thank yous. I didn't expect that.
I
Thank you.
think Leonard has a question.
Yeah, go ahead.
Hey, so I actually have a lot of questions. We're not gonna have time, but I might have missed it. Was there any integration of a dietitian or some type of nutritionist, or did that still fall on another clinician's role?
No, yeah, we do in specific cases where we find necessary. So, giving a diet review and looking at a food dietary, log and such, looking at what someone's education is on their diet, implementing diet specific to a regimen is something we, especially with the wellness coaching, can do. But we understand that we need to be able to understand nutrition enough to be able to recommend a diet to a dietitian when needed. Same thing with mental health and stress management, similar concept, but we do incorporate our dietitians in many of our clinics and across, our different patient populations.
Okay, thanks. So it sounds like it's more the duty of the wellness coach, which makes sense.
I mean, again, there's a crossover, but our goal is to not step on toes. But again, if we're saying this is our lane and this is our lane only, and this is when the dietitian comes in, there's not enough dietitians for patients that need nutritional information. Let's just start there. And to get to a dietitian, you usually have to be pretty sick or have a disease state that they're specifically organized around. So we believe everybody should have dietary and nutritional training and be able to talk about this stuff with their patients.
Cool, thanks. I'll ask one more and then I'll give everyone a chance. But I wanted
Leonard,
to ask,
before you do that, can I ask Scott to go back and put the CE slide up? That was
Oh,
a
yes.
request from someone.
Yeah.
Okay, go ahead, Leonard.
yeah, it's just last question. I'll let others ask. But
You're fine.
for eligibility and trying to stratify patients, so obviously this stuff can be applied to really any patient. But I'm wondering, how do you identify your patient population? Are they through referrals, or are you trying to assess your data for risk stratification? What's the rationale, at least on your end right now?
All of the above. I'm not trying to give you a runaround answer here, but it is all of the above because, it could come from a clinic that sees a patient and internally and then sends them to us, or externally, we bring a patient in because they're interested in a specific area that we are working in. Again, I kind of gave that example of preconception. If we offered a preconception program out there, or, a program in sports performance, in wellness around sports performance, again, I'm just using buzzwords in this regard, but we could bring patients into the system. So I kind of gave a little bit of a workflow earlier, but I mean, absolutely, we're working with evidence-based committees as well to understand what it is, not only just on the formulary, but what's coming down the pipeline, and then how we can work with those individual providers that are providing some of those things, like some of the new drugs down the pipeline and so on, or new modalities, and figure out where we can implement some of this. So it just depends on the clinic as well in that regard. So I hope that somewhat answered your question, but I'm super happy to talk to you offline as well.
Yeah, it's good. I'm good. So yeah, overall, awesome. This is really cool stuff. Very innovative. Awesome presentation. I'm good for now. Thanks.
Thanks. Sorry, it's very hard to do. We could talk for this for a long time, but it's very hard to do in such a little bit of time. Marissa, did you have something to add to that? I know you started. She's like, no, you talk enough.
They have anything, but when you talked about like how do we get our patients, it's both through referrals and anyone who is really like ready to make a change. I think that's one of the big things for us is we want to make sure this person is really ready to implement some kind of wellness behavior or something like that. It's important for them to be motivated and to understand like where they're coming from. So those are some things that we look at.
Yeah, if you have questions, like I said, you could raise your hand. I saw Leonard raise his hand.
I think Marina, you may be from New York. Is that right? Marina Buksov? You had a question about scope of practice? Are you able to?
Hi, yes, I'm sorry. I did. I am in New York, so we're pretty restrictive over here. And
You guys can't even talk about this.
Yeah, yeah. So I'm always very careful and cautious when I'm wearing my wellness, herbalist, health coach, hat versus pharmacist, and I make it a point to distinguish them. But my hope is in the future I could just combine it.
Absolutely. Did you
Yeah,
have a
I-
question or
Yeah,
just
so the question is, what is your, how can we all sort of start advocating for this, not stepping on other professions' toes or on our scope of practice, but embrace this wellness and pharmacy movement?
from a health
Scott,
system
can I
side?
take that for a second?
For sure. Absolutely.
Yeah, so Marina, a couple things that we've learned from working with, we have the Florida Medical Association down here. Don't talk about provider status. They don't like that. And I kind of understand where they're coming from. What we talk about, and we have a new nomenclature, is physician-led team-based care. So we are not here to replace physicians. We are, as the physician earlier alluded to, team members on his team. So physician-led team-based care. And also our mantra is pharmacists can help reduce physician medication administrative burden. So these are things that allow us to align with them. And then legislatively, we have collaborative practice agreements. I know Barbara's on from New Jersey. I don't know what New York's current collaborative practice situation is, but we could go offline to discuss more about that. Scott, did you have anything you wanted to add to that?
No, I think, and Marissa and Brandon will vouch for this, but I think the biggest thing and some of the things you asked about without stepping on toes is meet with people. First, figure out what people are doing and then figure out where the gaps are. See where, again, we saw a lot of dietitians when we were going in to apply this, what Leonard brought up. We thought, add a dietitian and layer them into every single piece. We realized there wasn't that many to add in. To begin with, and then per capita of population or whatnot. So when we looked at that, we said, okay, but then we also saw, okay, they're servicing specific disease states. Okay, well, what about these? And so we started to realize we have an opportunity to fit this gap. It's really about how do we do that. Sorry, there's thunder outside. If anybody
It's
heard
about,
that.
physician-led team-based care, I think. And
Yeah,
I guess the other thing that I would
we have-
say is that societies, join your state society. It's super important. And join a national society that you align yourself with. Whether if you're in a health system, FSHP makes sense, ASHP makes sense. If you're in a community pharmacy, FPA makes sense, APHA makes sense. Align yourselves with societies, because the societies are working very hard and spending a lot of money and time working to push these things through. So I'll get off my soapbox, Scott, but thank
No,
you.
you're fine. Kathy, we love you. So, Madeline, you were saying?
No, I was just saying there was a question in here where it says, do you see pharmacists implementing micronutrient testing within the wellness services? And yes, we are. I think that's one of the things that we're looking to help with. How do you actually help with a diet that's based on your own DNA? So there's a lot of stuff that we're doing that's very innovative that makes us different from everyone else. And I think being able to have those coaching skills and wellness skills are really important for the pharmacist to have. And it is a service that we are looking to do, and we partner with a very good company to look at those tests.
Marina, I'll tell you one thing is, as long as you stay within the evidence, you'll never not be able to answer a question from any team member of the care team. So I think if you could stay in the evidence, understand where the evidence is without extrapolating information, and be able to better outcomes, you'll always have a seat at the table and you'll always have an audience. So hopefully that answers some of your questions, but any other questions?
I think Brandia, was asking about NCQA, and then it is patient-centered medical home, which is legal in Florida. And I know a lot of our health systems are starting to do that. But I don't know that we're using collaborative practice agreements in that setting.
I mean, we'd also, Kathy, with your blessing, of course, but we'd be interested to see if, what the demand is for wellness across Florida to start, and other pharmacies, other associations, other pharmacists, and
Sure.
starting a group to talk about this, and providing the evidence and being a resource of information and helping each other grow in this space. But again, business side, the money's there. People are buying this stuff. It's who's going to provide it. Clinical side, how do we provide the best? How do we improve outcomes? How do we actually help people and not just break people's banks? The opportunity to do that is going to help payers see the benefit of this. So I use the MTM example. It wasn't paid for before. As pharmacists, we're doing that until it was in black and white, and in the proposals and recommendations and so on, and the whole process. Payers didn't pay for it, so we got to start somewhere, and we're willing to pull out the sledgehammers and shovels and build the framework. So we look forward to hopefully working with many of you to do that as well.
And thank you, Scott. So if you're not an FSHP member and would like to become one, you can also join the ambulatory care group, where this is going to be, I think Marissa is going to be leading a charge there in terms of incorporating wellness into and best practices and that kind of thing. So come and join us. We'd love to have you on the team.
Yeah, and I want to say thank you to everybody for joining tonight. If you have any questions, we could, I'll definitely put my email in the chat here. Risky business, I know, right, guys? But if any of you have any questions or want to connect, we'd love to, and I'll just send them all to Marissa. Just kidding. We'd all love to jump on with you guys and talk about what your initiatives look like, and how we could support you all as well. But we really appreciate the fact that there's this many people interested in connecting on this topic. So we appreciate all of you for joining tonight.
And thank you to our panelists, Madeline, Scott, Brendan, and Marissa. Thank you so very much.
Thanks for having us.
Have a
Thank
good
you all.
night, everyone.